Once someone's had the initial treatment for stroke, it's all about trying to work out why that stroke has occurred, and we do lots of investigations looking for the source of the blood clot. Might have been in the heart or the neck vessels, and there are some other less common causes of stroke. And then we also want to work on recovery. So there's a multidisciplinary team that will assess the patient for physiotherapy, occupational therapy, speech therapy, and make a plan for rehabilitation with that patient so they can work to get them back as much function as possible.
My name's Sarah and I'm a grade 2 physiotherapist working in neurosciences at the Royal Melbourne Hospital. When a patient is first admitted with a stroke, they meet a range of different allied health clinicians alongside our medical colleagues, and that involves thoroughly assessing the patient to find out what their movement's like, what their speaking and swallowing's like, and what their general function is like, as well as looking at other things like nutrition, because we know that when you're sick, you need a little bit more nutrition to help you recover. For me, as a physiotherapist, it's looking at their movement, looking at also things like that help us move, so sensation, coordination, balance, to really figure out what areas we need to target so that we can have that individual targeted approach to address those things and get them back to as close to life before the stroke as possible.
My name is Dr. Emma O'Brien and I'm the head of music therapy and scrub choir at the Royal Melbourne Hospital. Music therapy works really well for stroke patients, particularly in those recovery periods and across the course of recovery. The brain processes music differently from speech. Even when you sit down and listen to music, how that information goes into your brain is different from how someone speaks to you. And then conversely, when you express yourself in music, that's a different experience for your brain. It comes from a different side of the brain, a different part of the brain. They can sing clearly, they can remember all the words, and they can find and understand what you're saying to them. So it has this wonderful brain gym activity, basically. So as they're singing, they're starting to articulate and move their mouths, and they're getting that confidence back, because, you know, stroke can be 9 times out of 10 a terrible shock as well.
So many strokes are related to factors that we have some control over. So our lifestyle, our diet, our exercise levels are important. Like most cardiovascular health, we need to be eating a healthy diet rich in fruit and vegetables, nuts, and avoiding saturated fats and fried foods. We need to avoid smoking. That's a big risk factor for all kinds of cardiovascular disease. And we need to control our weight, because that can lead to diabetes and high blood pressure. For stroke, high blood pressure is the biggest risk factor for both the bleeding and the blocked vessel type of stroke. And so it's really important that we do see a GP, that we get our blood pressure measured, and that we know what the numbers are. And the standard number to remember in your head is 140. If your top systolic blood pressure is less than 140, we're in the kind of range we'd like to be.
We also know that once you've had a stroke, you're at further risk of having more strokes. So after you've had that initial rehabilitation following your first stroke, it's really important that you keep up your fitness levels, so continuing to work with your physio or exercise physiologist to maintain really good heart health and help reduce the risk of having another stroke that could be more detrimental.
Outcomes after stroke are really variable depending on how big the stroke is and what part of the brain's been affected. It can affect any of your brain functions, but the important thing these days is that we can treat it, and if you get to hospital quickly, in many cases we can reverse much of the disability that would otherwise have occurred. I'd really encourage everyone watching this video to know the signs of stroke, and to know if you see someone around you having that sudden onset of face or arm or speech difficulties, that you call 000 and get the system primed so that we can give them the best treatment.